Good morning, everyone. Thank you so much for joining us for the Dash Knowledge Base public launch. We're really excited to get started, and we'll wait a minute or two for folks to kind of trickle in, and then we will begin. And we will be recording this session, and it will be up on the Dash Knowledge Base as well, um, alongside all the lovely resources that we already have. Um, but I will introduce myself first. Hi, my name is Celestine Emberton. I am a senior program manager here at the Illinois Public Health Institute in the Center for Health Information Sharing and Innovation. I am the platform manager for the Dash Knowledge Base in collaboration with my other colleagues at IPHI and at the Michigan Public Health Institute. We'll hear from everyone in a minute, but first I would like to outline our agenda for the session. Can you move to the next slide? Thank you. So our webinar is split into four main sections. First, we have a background on the history of the DKB, which I will refer to as the DKB throughout this webinar, which is presented by NPHI. Then I will lead an overview of the platform, describe what kinds of resources we have, provide a guided walkthrough, and how to navigate and use it. From there, we'll pass it off to our partners at the Network for Public Health Law to talk about our first DKB collection, the Legal Library. We will then have some time for Q&A to answer any questions that you have about the platform. So in the meantime, if you have any questions, feel free to pop those into the Q&A feature and we will try to answer them either in there or revisit them at the end. And lastly, we do have a post-webinar survey that will pop up after the webinar closes. So we'll end about 5 minutes early to give everyone enough time to fill it out. And we really appreciate your feedback in advance. And with that, I will pass things off to Melissa Moorhead.
Hi, thanks. If I could get the next slide, please. Thank you for doing the introduction, Celestine. Next slide, please. So I'm the origins of the DKB with NPHI because I love to play a history professor. But what I'm going to try to do is describe the origins of the Dash knowledge base in a way that actually reveals its structure. It represents so many hours of careful curation that we hope is intuitive, but also to make sure that it's as visible as possible. Next slide, please. So as you may be aware, the DASH Program Office, which has long been a collaboration between the Illinois and Michigan Public Health Institutes, is winding down over the next 18 months. So this is our attempt to enhance access to the valuable research, insights, and resources we have collected and relied upon over the years. The publications pictured on this slide are some of those that DASH itself has produced, but we have also curated some of those key resources from partners that we found useful in supporting the field in the DASH knowledge base, or the DKB. Funding from the Robert Wood Johnson Foundation, which does not necessarily endorse the views and techniques presented here or in the Dash knowledge base, has resulted in community collaborations, creating change at the local level. The Dash always really wanted to make sure to elevate and share lessons learned and practical advice from all our partners, research and networking. Next slide, please. So while we've been dashing for over a decade as a program office, we now have the opportunity to anchor this work in our values and provide beacons for practitioners. The DASH team at NPHI's Center for Precision Public Health is building on the DASH knowledge base to create tools and templates that advance networks for community health and organizational resilience, giving us that anchor. The Building Equity, Accountability, Capacity, Organizations, and Narratives, or Beacon team at IPHI is similarly applying learnings from the DASH program to the organization's programs and initiatives by building capacity, shaping narratives around community power, and developing this clearinghouse resources, strengthening organizational infrastructure. Next slide, please. So why did we build the DKB? In plain language, it's meant to be a publicly accessible, searchable online database built to help people find and use practical knowledge about multi-sector data sharing for health. It was developed by the DASH initiative specifically to provide ideas, knowledge, and connections to anyone, including ourselves, working to build a culture of health. Many resource repositories exist in public health and healthcare, and they all add value to their contexts by providing that context and focus. We believe that few focus primarily on the complexities of considering data across sectors. Importantly, the DKB is not just a document repository, it links different kinds of entries, resources, projects, organizations, collaboratives, so that users can move from a concept like shared power or data standards to concrete examples and tools that address that concept. The DKB includes resources such as frameworks, guides, reports, webinars, podcasts, and briefs. We'll hear more about that later, as well as the projects, profiles of projects and organizations connected to our legacy of support. This combination matters because it kind of allows learning to be grounded in real world practices. Users can identify not just a toolkit, but also who may have used that toolkit or similar approaches and in what context. Another defining feature is its organizing structure. Next slide, please. Thank you. So the DKB is intentionally aligned with the DASH framework, which maps key considerations in building equitable data ecosystems, making it easier to browse by domains and discover connections where a resource or collaboration fits in the life cycle of collaboration. This structure also facilitates learning across contexts, highlighting projects and resources that illuminate how governance and trust interact with data infrastructure choices, or how policy and market forces shape what is feasible locally. The complexity of this work, which you may recognize as your daily life, it needs better visuals, and we are working on it. But in this version of the DASH framework, building equitable data ecosystems for fostering community health, we define community data ecosystems as being made up of the what, the who, and the how that enable data sharing and collaboration within a community. You can find webinar recordings of a three-part series about this framework in the DKB, of course. The who includes community members who are represented in and by the data and the forms in which they organize, in addition to the organizations crossing multiple sectors in those buildings in the background. The what includes various types of data and existing data infrastructure, and the how are core elements generally considered in the equitable design of shared data systems. This framework helps us dive deeper into how equity as a process and outcome can be the context for data ecosystems and a data infrastructure that is built to unlock the power of community data for social good. The factors we've identified relate to building foundation with community on the left-hand side, which includes a context of shared vision, trusting relationships, and shared power. In the center, you'll see our focus on multi-sector community data ecosystems centering equity, an infrastructure which includes considerations about sustainable finance, data governance and data standards, technology itself, and human and organizational capacity. Market and policy forces are not the same thing, even though they show up in the same bubble, but they're not entirely separate either. They operate similarly in the ecosystem. We put them at the top with arrows that encircle, because these are factors that influence all of the components in the environment, down to the community organizations and residents themselves. On the right-hand side, we've been developing programs and engaging with other networks working on the systems change outcomes that promote equity, health, and well-being. This includes narrative change, building connection and sharing power across sectors and shareholders, and developing and practicing equitable policies and approaches across entire communities. DASH has seen meaningful, sustainable, and equitable community health improvements made by initiatives connecting information systems and sharing data across sectors, particularly in ways that are community-driven and accountable to community members represented in or impacted by data and their use. This framework serves as a foundational conceptual tool that helped us make sense of all that we have learned about everything from the importance of strong community collaborations and backbone infrastructure to data dashboards, whole person care coordination, population level collective action for health, and building strategic narrative change initiatives to change structural conditions that promote community thriving. Next slide, please. So the DKB curates frameworks, practical guidance, and examples that can be used by those in different sectors with different perspectives to design agreements, build trust, and implement workflows that do not intentionally harm communities or unintentionally harm communities, even more importantly. This slide provides a little more context about how different organizations and sectors have shown up in local data systems work and how they are represented in the knowledge base. Social service providers, housing agencies, education partners, and justice stakeholders benefit from more data about how their activities influence health outcomes, but cross-sector collaboration can be different without shared language and credible examples. For policy and the legal audiences, such as state agencies, council and governance committees, legal and governance resources provide a path to actionable templates and landscape understanding rather than starting from scratch each time a data sharing question emerges. Researchers and evaluators can benefit from the DKB structural entries and relational links, which can help them understand how the field is evolving and where evidence exists or is missing. Healthcare and public health provides a lot of the actual data factors and community engagement components of this data system work. We hope that funders and intermediaries will use the DKB to identify promising practices, supporting smarter and more equitable support strategies. Across these audiences, a key design principle is that users can engage at different levels of familiarity, from just looking up single entries, browsing curated collections, following the DASH framework map, or requesting help through the Ask a Librarian feature, which we're excited to share in just a moment. Next slide, please. So why not just Ecosia? Or why not just Google? In honor of Earth Day, I won't pass up a chance to promote Ecosia as an alternative to Google, as Ecosia is a certified B Corporation with an environmental preservation mission and carbon positive AI search engine tools. A useful way to understand why the DKB may be better than Ecosia searching in our context is to look at the kinds of questions it was explicitly designed to answer, questions that recur across communities, sectors, and funding cycles. One category of questions is peer discovery. Who else looks like me? Practitioners want to find examples serving similar populations, operating in similar geographic contexts, sometimes even the same geographic context, or working with comparable infrastructure so that they can learn from experience instead of reinventing solutions. Another category is practical implementation. Teams might ask, what has been written? Where might we find a governance framework or a sample agreement, an evaluation toolkit, or guidance about privacy and confidentiality? The DKB moves beyond finding a document to learning from the field, enabling more strategic decision-making and more targeted technical assistance. In effect, the DKB is an attempt to answer the most common high-stakes questions in multi-sector data sharing: how to design, govern, and sustain equitable data ecosystems for health. How my experts organize all this information is addressed by building collections, which you'll hear about shortly. Next slide, please. So the public knowledge base is most valuable when it's actively used, shared, and improved through feedback. We invite you to participate by using it and contributing, as Celestine will demonstrate. We also encourage sharing the DKB with partners and colleagues, which creates a common reference point for cross-sector teams. The DKB is both a legacy product and a living infrastructure. It preserves what Dash learned, but also invites the field to help anchor and beacon carry that learning forward. The next step is simple: visit, search, and ask for help when needed, and tell us what would make the DKB even more useful for your work and your community. Celestine will take us away.
Thank you so much, Melissa, for that overview and just kind of going into the why of the DKB. So I'm going to tell you what's in the DKB currently, and as Melissa mentioned, kind of how we're building on that and hoping to make it an even more useful resource for you all. So the DKB is built and organized using a system of searchable tags. Many of them are based on the DASH framework. And within that, there are three main categories of information. We have organizations and collaboratives, which are profiles for groups related to multi-sector data sharing. And several of them are either former grantees or participants in DASH programming. We also have resources, which are links to material that support learning and action towards building and maintaining equitable data ecosystems. And as Melissa mentioned, there are several different types of resources, which include, but are not limited to, evidence such as white papers and research studies, case studies such as webinars, program examples and use cases, implementation tools such as toolkits, guides, and activities, policy considerations such as briefs or actual examples of policies, and example templates, which are MOUs, data sharing agreements, questionnaires, that sort of information. And they are all categorized by sector and type, which I will go into on the next slide. And last but not least, projects, which refer specifically to Dash grantee projects which received funding and or TA support during one of our grants programs. And those are also further tagged and categorized by grant program and year. Next slide, please. So the content breakdown. So as you can see, there's a similar amount of resources in organizational programs, but less projects because that is a static number at this point, as Dash is no longer making grants. But in terms of resources, many of them are curated by the Network for Public Health Law Legal Library, either published by Dash or All In or from other sources. And we are really hoping to expand the number of resources and add new collections exploring different relevant topics as the platform grows and changes. And next slide, please. And a little bit more into content breakdown. You can see the breakdown of resources by sector, and a majority of them are tagged under public health, social services, and healthcare. And before you ask, the numbers do not add up because most resources are tagged under multiple categories. And there are a few sectors that do not have as many resources as you can also see, which will be used to determine on our end what topics we need to dig into more, or if we need to find partners in that sector to help us curate that information from their perspective. And on the other side, we also have resources by type as a breakdown, and you can see that we have a lot of webinars and videos, tools and guides, and reports. Next slide. This is the portion where I will do the walkthrough for the DKB. So really excited to kind of go through the platform, show how information is organized, how to search, and other fun things like that. Hope everyone can see my screen. Um, so this is the Dash Knowledge Base platform. So in order to use the Dash Knowledge Base, you do have to make an account. You have two options on how to sign up. You can use a Google account or another email. And we added the Google single cert or SSO to make it easier for folks to not have to remember a new password, which definitely feel how difficult it can be to keep track of all my passwords. But we have the other option available as well if you do not want to use Google. Understandable. If you want to use Ecosia, that is your choice. And once you do that and sign up, you will have access to the DKB platform and be able to sign it. So the first thing is the landing page, and you'll see the global search bar, which is the easiest way to navigate the database. So if you search for a keyword, let's say in this instance you wanted to see information related to youth, just type that in. Took a second to load. And you will see the information broken into the three main categories that I outlined earlier, providing different types of information. And if you click on a link, a profile will pop up that tells you all about that project, including a short description, project highlights, and other details. So I click on this link, I can see a profile pop up that tells me about the project, outlines the highlights, tells me some of the details of the project, such as which funding program it was a part of, start date, end date, relevant contacts, priority areas, priority populations, and collaboratives that are affiliated with the project. This one also is tagged under some framework tags as well. And as you can see, there are some related resources down here as well. And you can see that one of those resources is an all-in webinar led by the Hartford Data Collaborative from 2022, which you can watch on the Dash YouTube channel. So just a really cool feature. And of course, all of the profiles have been looked at and approved by the project folks. So yeah, if you are one of these folks who have a profile on the DKB, you can always reach out to me if you need anything to be changed. And the next category here is resources. So if you look for the pop-up of a resource, let's click on this one. You can see they're tagged by sector. Um, and there's also a description. This one happens to be a YouTube video, so there is a link, and you can see the other details about the resource. We also have a couple of feedback mechanisms built into the page, as you can see. We have a report link as broken button in case you click on the link and it doesn't work or it leads you to the wrong video. You can just click on that link and it will send us a notification that we need to look into that. And of course, we do our best to remove and update broken links. And as you probably all know, with the federal government doing what it does, sometimes the links break in that way, or sometimes people move web pages. But if you're not able to navigate to a resource, just let us know. And there is also a thumbs up or thumbs down button, which just kind of lets us know if this resource helped you or was described accurately on the page. And then there is organizations and collaboratives. And those profiles detail information about the organizations that are relevant to data sharing or participated in Dash grants. So if I click on this one, you can see the kind of information that you can see. Just the sectors, a short description, the type, address, website, contacts, all of that fun information. I think one of the most useful um, sector ta or tags for organization and collaboratives is priority populations and sector. It kind of helps you find folks that are aligned in mission or are just kind of doing similar things to you. And that is the global search. There are also a couple of other functions that you can use, such as sorting. So the algorithm for the search function um, is kind of designed by default for relevance. So basically what's closest to the search term that you use either in the title or description. You can also use alphabetical or most recently updated, and that's helpful for sorting. You can also use more detailed filters. So we have quite a few filters, um, and the search will kind of help you drill down into finer details, especially if you have a broad search term and you're looking for something specific. So, for example, if I look for something that has a lot of resources, like public health, the algorithm will do its best to limit the number of results just so it's not extremely overwhelming. But from there, I can go into the filters and see the different categories that pop up. You can pick, there are a lot of different options here. So if I added, for example, um, a priority population, I'm working with justice involved folks, it'll narrow down the search results based on the filter that you've added. And that's just really helpful if you're looking at specific resources. So going back to the homepage, there is also another way to search, which is by category. And this kind of has some different features attached to it as well. So for example, if I go on projects, I can see that there's 220 entries. And if I search through this search bar, the smaller one, I can search through just projects. So if I look at a specific term, like food bank, it will show me projects that are working with food banks. And of course, if you scroll down, the results become a little less relevant to your search term. But you can also filter things as well. In here, for example, if you wanted to look at Um, People with chronic conditions, you would get a smaller number of results back that will be more relevant to both of those terms. And another great feature that I really love searching by category is that you can actually export all of these results into a CSV file. And that is great if you would like to come back to it later or if you would like to share it with other people. That's just a great way to do that. So now that we've gone through the different ways to search, if you scroll further down the homepage, you can see the Dash framework. So much like Melissa was talking about earlier, a lot of the things are categorized using the Dash framework. And if you're familiar with it, it is a way to map out all the potential considerations for any multi-sector data sharing project. And using this page, you can click any part of the framework and see our suggestions as Dash staff as to relevant resources and projects related to that topic. And so even if you're just getting started or want to improve existing collaborations, there is plenty of content for you to look through. So for example, if I wanted to learn more about shared vision, I would click on that and this would pop up with all the different projects and tools and reports that we would recommend for you to look at. We have that for every part of the framework. So just a really great way to learn more about relevant resources, projects, folks who are doing similar things. Um, and if you scroll down, it's a little bit about the framework. And if you need a refresher, some descriptions of the different topics as well. And certainly, not least, going back to the homepage, there is collections. And these are roundups of topics that are curated by Dash or other partner organizations that contain the most updated information in the database. And currently we have two, the Legal Library and Narratives and Strategy Library. I will let NPHL go through the Legal Library, but if I click into Narratives and Strategy, you can see that there are 37 resources in here and they are organized as a collection. There's kind of a little blurb about the collection. And this was curated by IPHI staff. So go out for that. And you can just kind of see relevant information about narratives and strategy from kind of a practical standpoint. You can also export these as well in case you want to revisit it later or add any notes that you have about this topic. And before I hand things over to the Network for Public Health Law, one last feature we have is the Ask the Librarian button. So if you click this button in the bottom right corner, it'll open up this form that basically sends us an email. So if you have any ideas about possible collection topics, if there is an issue with the DKB, basically anything that you can think of, um, just fill out this form, submit the question, and you can decide whether or not you want an email confirmation. And it will get sent directly to the DKB team. So that's me and Santiago, and we will respond to you as soon as we can. We can also use this to, if you have a question about resources that are available or you can't find something, you can ask us. And if you would like to connect with one of the organizations that are listed under organizations and collaboratives, we can also do that for you as well. So that concludes the walkthrough. And I hope it was useful and you've log in and find ways to use the DKB. And with that, I will introduce our Network for Public Health Law presenters. So first, we have Shannon Piccolo, who is one of the senior attorneys for the Mid-States region who focuses on data and privacy law. Prior to joining the network, Shannon spent over 16 years working in local government as a civic deputy county attorney, chief deputy county attorney, and director of public health for Park County. Shannon graduated with honors from the Alexander Blewett III School of Law at the University of Montana, received a certificate in environmental and natural resources law, and served on the editorial board of the Public Lands and Resources Law Review. She also earned a certificate in public health from the University of Montana School of Public and Community Health Sciences. And our other presenter from NPHL is William G. Hardison III. He serves as the Administrative Project Manager for the Mid-States region, where he provides operation and program support. William received a Bachelor of Arts in Communications from the College of Charleston. Prior to joining the network, William worked in public relations for a number of years, focusing on the lifestyle and hospitality, food and beverage, energy and fuel, and alcohol and spirits industries. Most recently, he has spent over 4 years working with the South Carolina Department of Public Health in their central office, where he served as the Professional Practice Program Coordinator. In that role, William managed high-level administrative operations, including procurement, logistics, grant funding coordination, and financial administration. He is currently serving as a member of the SCDPH Institutional Review Board. And they've been great partners in creating the legal library, and I'm so excited to have them presented to you. And with that, I will pass it off to them.
Thank you so much for this great introduction, Celestine. It is great to be here. And again, I'm William Hardison. Good morning, everyone, and thanks so much for spending some time with us today. If we could pop to the next slide, please. And I just also wanted to highlight that the legal library team also included one of our amazing deputy directors, Megan Mead, who is also joining us on this call today. And also, in the interest of time, we'll move through these a bit quickly today to allow appropriate time for Q&A. And next slide, please. And so first, we'll just touch on the methodologies used to curate the legal library collection. And next slide, please. Our approach. So NPHL employed a structured two-phase methodology to ensure that the objectives of the legal library update were met. This process differed somewhat from the approach taken for the 2017 legal bibliography, which included a time-intensive process of reviewing and coding sources generated from internet searches and resulted in a published paper. And so while the methodology used in developing the 2017 legal bibliography informed NPHL's approach in 2025, we've also leveraged the deep expertise of its team to conduct more streamlined research, as explained in the expansion phase in the following slides. And so now I'd just like to take you through some of these domains for a deeper dive in the questions that guided us throughout the project. And next slide, please. Oh, we're good there. Actually, next slide, please. And so we'll start with our review phase, and the four domains that we looked at for phase one are accuracy checks. So in addition to the review for these domains, the team also checked the accuracy of the title, since things may have been edited over time to better reflect the substance of the resource, or in some cases to protect the content from removal under the current administration's guidelines. And we also checked the year of publication, publisher, author, and description of every single resource, with revisions made as needed for clarity and accuracy. And we'll move on to link verifications. We also verified that all web links were still functional and directed to the correct materials. The team also added tags for each resource that included sectors, priority populations, and Dash framework tags to better help users sort through and find resources relevant to their search terms. The removal of certain resources. So resources more than 10 years old, for example, published in 2015 or earlier, or those predating significant legal challenges were flagged for removal. For example, resources discussing HIPAA from before 2013 amendments were identified as outdated, as were Part 2 resources from before 2020, which predated 2 updates to the rule. And so during times of uncertainty between team members, certain resources were flagged for consideration by Dash. Content gaps. The team also assessed the collection for content gaps, including the absence of resources addressing specific populations, and noted this for phase 2. And we also wanted to note that for both phase 1 and phase 2, all resources underwent 2 independent reviews by team members to determine whether they should be included, flagged for further consideration, or removed. And next slide, please. And this brings us to our expansion phase, where much energy and time was focused on. And so the domains that we looked at for phase 2 are archival research. So the network began by searching its own extensive archives of data sharing resources, along with new resources identified during the review of the 2017 legal bibliography. The team also tracked new resources received in email newsletters or shared in webinars throughout the 6-month course of the project in an effort to collect timely and pertinent resources. And that brings us to expertise engagement. Following these initial steps, the network then engaged colleagues and partners with expertise in data sharing and privacy to identify any additional materials that may benefit the legal library. Our governmental and non-governmental research. So we conducted a search of the websites of governmental and non-governmental organizations involved in data privacy and sharing, including but not limited to the Pew Charitable Trust, Actionable Intelligence for Social Policy, and federal agencies such as the Health and Human Services Department and the United States Department of Education, which also informed the trends that we saw in data privacy and sharing, and that Shannon will touch on more in a minute. And so that brings us to our last domain, which were targeted web searches. So finally, NPHL conducted targeted web searches using key terms. And so searches comprise of a mix of general terms like data sharing legal frameworks and more specific searches like data sharing veterans legal. And so particular attention during this phase was given to identifying resources that addressed underserved populations, including LGBTQ plus individuals, people with disabilities, people experiencing homelessness, incarcerated populations, and people belonging to historically underrepresented racial and ethnic groups. And we do find it worth noting that multiple internet browsers, Google, Edge, Firefox, etc., were used to aggregate these resources, and that depending on the browser and search engine configurations, searches may yield different results based on commercial algorithms, SEO, ad buys, and other factors. And with that, I will turn it over to my fantastic colleague, Shannon. Next slide, please.
Thanks, Will. Now I'll go through just a highlighted overview of the resources that are contained in the legal library and the trends that we saw that emerged. Next slide, please. The updated legal library includes 171 resources, 48 of them which were retained from the 2017 bibliography, and 123 resources were added. There was a significant increase in newer materials from 2023 through 2025. The areas of public health, healthcare, and social services were significantly represented, but it is important to note that data sharing is inherently cross-sector and included many other partners. Overall, this collection reflects a growing and increasing collaborative field. Next slide, please. We saw several trends in the resources, and these included equity, partnerships, community engagement, tribal, templates and model agreements, and pathways to sharing data. Next slide, please. One of the biggest takeaways is the shift in focus from the resources of 2017. Earlier resources emphasized compliance and focused on how data cannot be shared. Now the field is moving towards a practical guidance on how to share data lawfully. We are seeing more tools like templates, model agreements, and decision frameworks that help put data protection laws into practice. This is a shift was accelerated by the pandemic, which highlighted both the gaps in data systems and the need for modernization, with a new emphasis on collaboration and health equity. Next slide, please. Equity and cross-sector collaborations are now central themes in the resources. The resources increasingly focus on partnerships across public health, healthcare, and community organizations to address the social determinants of health. There is also strong emphasis on engaging communities throughout the data lifecycle, ensuring their voices are heard and considered when data is shared, collected, and used. Many resources include toolkits, case studies, and learning models to make these approaches practical and scalable, with many focusing on specific populations. Next slide, please. We're also seeing more resources tailored to specific case studies and populations. As Will said, these include areas such as housing, food insecurity, immunization systems, and underserved populations. To support this work, resources provide practical tools such as data use agreements, MOUs, and HIE participation agreements. A key theme is ensuring that these agreements are adaptable to state laws and clearly define how data is accessed, used, and protected. Next slide, please. We also saw several emerging issues and trends. First, resources are shifting away from asking, why can't we share data? to how can we share data lawfully. Tribal data governance is gaining attention with a focus on sovereignty and government-to-government relationships. There is a growing emphasis on using more detailed race and ethnicity data to address inequities while maintaining strong privacy protections. At the same time, there's concern about data misuse and preservation of historical data. As we all know, AI is also gaining traction, and this is an area to watch as laws and data practices evolve. Next slide, please. Just to quickly recap, there's a few takeaways. The project in the legal library, as we'll describe, it was a two-phase approach, reviewing the 2017 resources and expanding on this collection with newer resources. We see a clear shift away from compliance-focused resources towards practical, equity-driven approaches to data sharing. There is a growing demand for easy-to-use tools like templates and agreements that help practitioners apply the law. And looking ahead, we expect more focus on data protections, security, and preventing misuse of data. Overall, the field is moving towards more responsible, collaborative, and actionable data sharing practices that support both public health and equity goals. The NPHL also produced a legal library landscape analysis, which detailed this methodology and the resources and trends that we presented to you today. Next slide, please. And since we're lawyers, we always have a disclaimer. The Network for Public Health Law is a group of attorneys who provide technical assistance and information only. We like to say we are attorneys, but we're not your attorneys. So please consult your own lawyer when you're seeking legal advice. And now I'll pass it back over to Will. Thank you very much.
Awesome. Thank you, Shannon. And if we could pop to the next slide, please. And here are just a few more ways to connect with the network. If you're interested in hearing more about the Legal Library Collection or want to otherwise engage with the network, like Shannon said, we offer a variety of services. So please reach out if you're interested. And next slide, please. And in case you wanted to reach out to our team specifically, I just wanted to include some of our contact details. And again, thank y'all so much for being here with us today. And I will turn it back over to Celestine and team.
Thank you so much. Great to hear more about the methodology and the reasoning behind the legal library. Such a great resource that we're able to offer to folks. And thank you so much for coming and sharing more about this collection that you've put together. I don't know if you want to also add, I think there's another link to um, request assistance from you all if you want to share a little bit more about that.
Yeah, Shannon, would you like to share more on that one?
Sure, I'll put a link in the chat, but the Network for Public Health Law does provide legal technical assistance up to 4 hours. So if you do have a public health related question, please feel free to reach out to you on anything more than data that we talked about here in data sharing. We do that, but we have a lot of attorneys at the network that specialize in harm reduction, the environment, reproductive rights. So look for that in the chat. Thank you.
Yeah, thank you so much. And yeah, I would say definitely very important resources you all offer. And it's been great to do this in partnership with you all. So that concludes our webinar. Thank you so much for attending. And we'll send a couple links in the chat shortly. But now we open up the floor for questions. And you can submit those in the Q&A function, and we will answer them the best we can. Yeah, it seems like only the host can add to the webinar chat, so bear with us for a moment. But yes, we do have a link to the legal library analysis. We're also planning to do a more public push of that as well. So if you follow any of our Dash channels, you will also see that likely in your inbox from our email blasts. But we will be sharing that more publicly just to make sure that people know about this and that they're able to use it and see if there are any um, additional resources that could be added to that. So, yeah. Any other questions that people have? And then I've seen all of your questions about the acronyms. So sorry about that. We all live in acronym land space, and sometimes, yeah, forget to define things.
I'd like to go ahead and tackle a couple of the Q&A questions live. Uh, Particularly, how do you define equity-focused data sharing? I'll tackle that one just by saying that that is part of a conversation, right? We define it through investigating the landscape of community data systems. Might be a little bit unsatisfying, but also, the different contexts matter. And so what we are uh, promoting is a data landscape where community information about community members and communities themselves are used to promote the thriving of those communities and not extracting information from communities or unintentionally harming the way that people live in their environment.
Thanks, Melissa. I also saw another question about food as medicine, specifically in Illinois, and that has been answered. But if you would like to add your program information to the DKB, all you have to do is send us an email with a description, and we'll let you know what kinds of information we need from you to get that added. Any other questions? I also see that things are being responded to as well.
So I saw that someone mentioned a need to explore the resource first, the Dash Knowledge Base or DKB, which is so true. And I just wanted to highlight how excited we are to be able to offer that Ask a Librarian button, right? So any questions that do come up in the moment, happy to dig into that and provide a response.
I am not seeing any more open questions. Um, yes, I can go over again how to get to the DKB. Um, and it's a little bit easier if I show you from my screen. Let me share that really quick. If I go into incognito, I can actually show you what the sign up looks like. Give it a second. Yeah, so this is what the sign up page looks like. You can sign in with Google or with your email. Um, and yeah, that just provides you access to the site. Um, so pretty straightforward, I think. But again, if you have any questions, you can always shoot me an email. And I know someone asked about the presentation. Yes, we will be uploading it to the Dash website. And it will also be in the DKB as well. So you'll be able to access it there as well. But yeah, seeing no other questions. Yeah, and if you don't know, our website is dashconnect.org. and we'll have updates about the DKB. We also have a DKB webpage there as well that will take you to the DKB directly and kind of provide some of this information. The slides will be up there as well, and the recording once we get that onto our YouTube. We actually have more than 5 minutes left. So, yeah, appreciate everyone coming. Thank you so much. We really look forward to having you use this resource. Um, yeah, just appreciate everyone being here and getting to share in this with us. As Melissa said, it has been years in development, a lot of work from a lot of different people, and yeah, it's really great to have it finally out in the world. And we'd love to see what you all do with it and what kinds of things that we can help provide as well. So on that note, I will end the webinar. And just as a quick reminder, please fill out the survey. It's 3 questions, not not that long. So yeah, and we appreciate your feedback. Thank you, everyone. And
Thank
a lovely
you.
thank you to our presenters as well.
Yes, thanks again for having us. We really enjoyed being here today with y'all.
Thank you.
Yeah. Thank you so much,
Thanks for
everyone.
everything. Yeah. Just
Of
being there.
course, always a pleasure to partner with y'all.
Yeah. All right.
Bye, everyone.
Bye.
Bye.